24 hours after routine aortic valve replacement, a heavy calcified wall and a patient heart rate abruptly falls to 40. This is a heart block. Nerve injury is supracondylar fracture of humerus median. Nerve passing through lateral to humerus, then anterior at the lateral radial. Injury to parietal lobe will result in lesion at parietal lobe. Radiation. Alcoholic patient history of all lateralizing sign. Lateralizing sign. Alcoholic, subdural. Sciatic pain path, single trunk above, single trunk below. Inguinal ligament forms superior border of femoral triangle. Impact at temporal bone, medial meningeal artery causing EDH, location Thurion. Bones involve frontal bone, parietal bone, squamous part of temporal bone, and greater wing of squamous bone. Picture with incision at lateral side of the foot, nerve injured, lateral sural nerve. Popliteal, most tibial nerve, most deep popliteal artery, most lateral common peroneal, most medial tibial nerve. Okay. Sinus tarsi between calcaneum and talus. So this is the picture of sinus tarsi between calcaneum and talus. Fine. This is the another picture between calcaneum and sinus tarsi. Mesothelioma is a vascular tumor, primary tumor of lung, epithelial tumor, and tubular cells. Mesothelioma. Mesothelium. Epithelial tumor, pleural tumor. Female who is noticing intermittent discharge since 6 months. History of nipple piercing, no lump on physical examination, and USG diagnosis mammary fistula. Intermittent, there is mammary fistula. Nulliparous 30-year-old woman presenting with recurrent pain, red area, areola gives history of smoking cigarettes, history of squamous metaplasia of lactifreza, greenish discharged ductectasia. Mastitis is there. Single duct bloody discharge in papilloma and multiple. Patient history of breast surgery while she was abroad. Now presented with red erythematous and 3 lumps over the site. Breast fibroadenoma, phylloids, breast sarcoma. Nulliparous woman, rainfall area, she gives history of cigarette smoke, breast abscess, mastitis, now present with red. Female with mammography shows no lesion. 2 years back was normal. Target USG breast tissue abnormality, fat necrosis. Lobular carcinoma. What? Indications for MRI as first line. Young woman less than 35 from history of BRCA. MRI detects early occult breast implants. MRI. Inconclusive findings on mammogram, triple assessment, preoperative staging, multifocal, invasive lobular carcinoma, poorly defined, axillary mets. Which antibody is a pentamer? M. Child with mass in the right abdomen, hematuria, and initial investigation. There is a mass in right of abdomen, hematuria, initial USG. Old man on rivaroxaban falls on the back of head, feels completely fine. CT 8 hours. Where is MRCS2? MRCS2, this. In that, if you continue the questions, patient on morphine, you notice, has a pinpoint pupil in respiratory depression. You prescribe naloxone. What is the mechanism of action of competitive antagonism? Morphine acts on mu. Mechanism of action of tranexamic acid is plasmin inhibitor. 56-year male present with the active surgical stake and severe abdominal pain, normally fit well. He has no malignancy. Biochemistry contract reward. His corrected calcium is 3.6. What is the initial management? So normal saline has to be given. Hypercalcemia. Post renal transplant double DR match. DPDQR become anuria in the ward. Bladder irrigation done freely. Done free flow of urine drain noted. Likely cause urethral blockage or what? Renal. Okay, free flow is noted. Renal artery thrombosis. Here it is. Urethral blockage is not there because bladder irrigation done, free flow of urine drainage noted, means after irrigation bladder is draining, means there has stopped. So this is clear cut renal artery thrombosis. Why? Post renal plant double match become anuria in the ward. Sudden anuria, there is urine drainage after irrigation. This is one drainage after irrigation. Urethral block means it's mechanical option. There is urine flow after irrigation or flushing. Anuria with clear irrigation. The key clue is that bladder irrigation results in free flow of urine. This indicates that urinary drainage system below the kidney is functioning. And the problem must be that kidney is no longer producing. This is what the explanation. Bladder irrigation is working. Renal artery thrombosis is an emergency condition which main artery supplying the clot. Kidney stops producing. Urethral blockage, bladder outlet obstruction, these are ruled out by fact that bladder irrigation allows free flow of the urine, confirming patency of urinary tract, and ureter assuming irrigation catheter is correctly placed and functioning. Rivaroxaban mechanism of action. Rivaroxaban, direct inhibition of factor 10. 70-year-old man fit, no compromise, subcapital fracture. How would you manage subcapital? 70 years. Cemented total hip replacement. Okay. Hip replacement total. 28-year man collapses and found to be deeply comatose and GSCS of 3. Now CT scan shows extensive subarachnoid and urinary catheter is inserted. What type of urine would be expected? 30 ml. Yes. There will be comatose admitted and extensive subarachnoid hemorrhage. 30 ml of urine. Whether it will be syndrome of inappropriate antidiuretic hormone. Will it be there? Concentrated urine, diluted urine, or what will be there? Explanation. E is the best answer. Subarachnoid lead to polyuria, excess urine and diluted urine, primarily due to development of central diabetes insipidus. This was the explanation. Was prescribed thiazide diuretic plus urine output improved. Which is the mechanism? If the patient is given thiazide diuretic, loop diuretic, his urine output improved. What is the mechanism? Thiazide plus loop, synergism. 14-year-old child with left knee pain and knee was normal. Next step, X-ray hip. 14-year knee pain. You have to do X-ray for slip disc. RTA suffered aortic disruption. Which part? Descending aorta. Aorta affected, descending. Post-open midline appendicectomy, After 6 days, you notice serosanguinous discharge from the wound. What is the cause? There is only reasons. Colles fracture managed by the cast presented after 3 months with wrist pain. Inability to extend thumb. 3 months with wrist pain. Inability to extend thumb. It's non-union or yes, non-union. 6 month malunion, more than 6 month no, avascular above. After Colles fracture, cast removed patient now can't extend thumb, extend pollicis longa injury. Which tendon lies in the third compartment of extensor retinaculum? Extensor pollicis longus. This is the medial border of snub box, posterior medial. Median nerve supplies to median nerve, abductor pollicis, flexor digitorum profundus, fourth lumbrical. Abductor pollicis is also there, but flexor digitorum profundus half part is also there. Second and third, FDP half part. Recurrent, it is recurrent. Where is apixaban, direct oral anticoagulant factor 8 inhibitor should generally be stopped 2 to 3 days before major surgery or procedure with high bleeding to minimize the risk. For minor surgery, low risk procedure, stopping. Okay, 41-year-old patient present with back pain on X-ray, and there were narrowing of the joint space and subchondral cyst, which is likely. So these are all features of osteoarthritis. Scone, subchondral sclerosis, cyst formation, osteophytes, narrow joint space, abural joint. Needle aspiration in the second intercostal space, mid-claviculi, what structure is likely to be damaged? Second intercostal nerve, third intercostal nerve, internal thoracic artery, mid-clavicular line. So it means that second intercostal space is between second and third. So third intercostal nerve or second, it is second intercostal nerve. Okay. There is some scenario of internal iliac artery getting compressed by some external structure. Then which is correct anatomical relation? Vein. This is about internal iliac artery. Vein is anterior to artery, vein is lateral to artery, ureter is anterior to artery. Ureter is always anterior. Artery is anterior to vein. Artery is posterior to vein. Vein is anterior to artery. So this was about the renal. Which scenario? Internal iliac. Vein is medial to femoral vein is medial to femoral artery, right? If you are looking at them from side, vein is anterior to artery. The internal iliac artery typically lies more posterior and medial to artery. Internal iliac vein syndrome is called Turner syndrome, also known as iliac compression syndrome of Cockett. It occurs when right common iliac artery compresses left common iliac vein. This is normal. So common iliac artery and vein. Artery is anterior, vein is posterior. So D was right. Artery is anterior and vein is posterior. Right common iliac artery and vein is posterior. 29-year-old woman presents to the image department with a thirst and she does not smoke and has a rash resolved 3 months after prior presentation. Her history is otherwise unremarkable. Her lung X-ray shows hilar shadowing. Serum biochemistry is performed and this reveals corrected calcium phosphate, alkaline phosphate, normal saline, a weak letter. Corrected calcium is within normal range. Which of the following is likely? Sarcoidosis. All calcium is raised, sarcoidosis. Most likely amyloid composition in the heart. Beta amyloid is ATTR. Patient notices a discharge from the anus with a fissure plus abdominal pain. What will be? Fissure, drain with acetone, sonography, colonoscopy. Healing from the internal, so drain with the abscess with the acetone. History of Thornpike looking for the organism, Staph aureus. Okay, Staph pyogenes, not aureus. 50-year-old patient with a splenectomy operation receives 3 liter dextrose. What is the initial change that occurs in the patient? GVP, urine osmolality, decreased urine osmolality, oliguria. Lot of dextrose is given, so there will be. So body will try to pass it, decrease the urine osmolality or what? Patient present in a muscle weakness, polyuria, Cone syndrome. What is the consequence? No. What is C? Why not C? Yes. Decrease urine osmolality. Blood pressure is 135, sodium is 142 and potassium diagnosed on the Cone syndrome. Sodium will be retained. Increase plasma volume, increase renal secretion, increase interstitial fluid volume, low increase plasma volume. Why not D? So why he is telling sodium and water, low urine osmolality. Osmolality increases because more water is concerned. More water is Cone syndrome, more water is bifurcation of carotid artery. This is C4. 23 lady present with posteriorly sighted fissure. Which of the following is the most appropriate treatment? Lord's procedure, injection, glycerol trinitrate, topical. 53-year-old female presents pain, stitches in her hand, especially at 9. Mother, history of autoimmune disease. What is the expected histological finding? Needle crystals, necrobitic granuloma, sulfur. Develop pain, stitches in her hands, or especially at night. Her mother had history of autoimmune disease. Necrobitic granuloma. Minor blood loss, no biliary slippage, no leakage. How to describe the wound? Clean, contaminated. Which are the major cells in granuloma? Macrophage. One patient's blood transfusion line was connected to another near miss. One of their night shift near miss. Near miss is an event that could cause harm but was corrected before any harm occurred because blood transfusion was happened to wrong patient but caught in the time. Which blood test should you do for 14-year-old undergoing electrotonsillectomy? None of the above. Pyloric stenosis symptoms given as initial management. IV fluid. Post trauma can't abduct the shoulder, paresthesia lateral arm and forearm, nerve involved. Hmm. Upper thoracic, lateral arm and forearm. This is musculocutaneous but axillary. Lateral arm and the forearm paresthesia. Patient had tibia and fibula fracture. Patient operated, shifted to the ward. Next management. Her severe pain, release compartment. Fromet sign for abductor polysis. Oh, adductor. Child post lung surgery can't push himself from crawling to standing. This is thoracodorsal. Long thoracic, no. Child post lung surgery can't push himself from crawling to standing. Serratus anterior. Okay. Loss of sensation on lateral aspect of the arm. Yes, lateral aspect. C5, C6. Post-laparoscopic appendicectomy. Patient feels shoulder tip pain. C5, shoulder tip. C6. C3, C4, okay. C3 to C6. Phrenic nerve basically. 3-week-old baby exhibits projectile vomiting shortly after feeding. On examination, oleo, this is CHPS, hypertrophic pyloric stenosis. 1-month-old child feeds on the milk and vomits after and gains weight, pH electrolyte. 1-month-old gains weight, pH and electrolyte electrolyte all under normal. What is the diagnosis? Vomits after some time, gains weight, pH electrolytes, feeds on milk. GRD. Which of the following depolarizing agent? Succinylmethonium. Antiphytic for bacteroids. Metronidazole. Biker fell from the bike, injured his leg. When examined, found there is laceration over the exposed tibia. What is the management? Local flap. 30-year-old suffers from the deep burn to the legs. Free flap. The 90 standing asthma takes prednisolone and needs to undergo operation. Most appropriate may to steroid, increase steroid. 9 male patient with long-standing asthma takes 50-minute prednisolone. Increase the day on day 1 and decrease no. Stop pressure, continue normal dose no. Day 1 and continue 3 days. A. Charcot-tried, Reynolds pentate, fever, jaundice, this fever. True about complement. C3 for mast cell, C4 for opsonization, C5 can lyse membrane. Opsonization or C5, A6, 7, 8, 9. complement pathway. This is classical, alternative, and lectin. These three important. Classical is bacteria IgG. They use C1. This is important. They go for C3 converters, C3A and C3B. Alternative is C3 is converted to C3 and CP, and third is lectin, mannose binding C1. All they act on C convertase to C3. C3 is connected to C3B and C3A. C3B is opsonine, it can convert C5 to C5 and 6A, 7, 8, 9 membrane attack complex. C3 and C mast cells, C3 chemotactic and C3B is opsonization. All opsonization. Site of tracheostomy 1 cm sternal notch, medial between sternal and the cricoid. Patient has raised intracranial pressure, which is not a measure to decrease intracranial pressure. Raise the head of the BP, okay. Hypothermia, mannitol, hypocapnia, hypothermia. So this was the last